Hey, alright. This is like day 0 of my transition with hormones, with testosterone. And I'm making this video and any other videos because whenever I would search for videos on this topic, people's transitions, subreddits, or advice, it would always be way after the fact. It wouldn't be in the moment when they were really just starting out. So this is here for anyone who needs or would like to and comes across this resource. Just one random person on the internet's experience with transitioning. I'm going to start by reading a letter that I wrote myself as I was getting ready to start just the phase 0 of transitioning. This is after I had just made my appointment with my campus's health center. I'm currently a student in my last year of their bachelor's degree. And this year, my college's student health center said that they would be having a new program called GAHT, Gender Affirming Hormone Therapy Program, where a doctor from a regional medical center that's experienced working with genderqueer and transgender individuals come over twice a month to my college's health center and help train one of the doctors there to work with trans people or people seeking gender-affirming hormone therapy, which would be me. So I saw that email. I called the health center. I choked on my words a little bit because I'm kind of suddenly coming out to this person over the phone, and made the appointment. And subsequently freaked out about it. Because I've tried to dip my toes into like maybe finding someone to start transitioning with hormones a few times over the past year. Had kind of resolved myself to saying like, alright, this is something I'm going to wait until I'm done with grad school and I've got a permanent address and I've got my own health insurance and I've got a salary, a stable job. And then it kind of was a sign when I got this email that I should start now. And, you know, why wait to start living my best life? So I wrote myself a letter one night in my notebook, just one page, and it goes, Dear Jax, whenever you take steps like this, you always get so excited. You feel like you've waited long enough. You can see it so clearly in your mind and get impatient. So I have a request for you. This time you must fight for it. Fight for it as hard as you can. Do everything to make this happen. Do all the clerical work, all the painful shit, all the confusing crap you don't want done. This time, do it. You've been in this body long enough, it's time for it to go. Chase it down until it's yours. Keep it organized. It's your life after all. You can do this. You finally have the words to say what you are and the tact to say them. This is one huge growth opportunity and you're going to get through all of it. Don't let them push you away. Make them treat you. Find a way. And never forget that I love you. I love you more than anyone else because I know you truer than anyone ever can or will. I love you. Jax. As you can see, I was very apprehensive. I was very afraid they would turn me away, try and send me to some other clinic, try and send me to another doctor to get treatment, try and send me somewhere that was off of my campus that would take a lot of time, and effort to arrange, and to my surprise, it's been so incredibly easy, and I just like can't believe it that it's just been this easy, and I hope that for everyone it's this easy. Though, you know, one trans experience is one trans experience. They're all going to be very different. So, anything I talk about is just the way that it's worked out for me. Um, and I really wish those out there looking to start transitioning, I really wish I could tell you there was a way to start and do step 2, step 3, step 4, and there was a whole guide to this, but really it is a very dependent on just who you are and where you are in life. I'm currently 21 years old, and my parents I'm out to, and they're starting to realize that I am my own person and that I am an adult and that I will soon be living on my own. Um, so that means they are supportive of this but not understanding. Um, so it's really the best I could ask for is that at least they're making an effort every day. And soon will be reminded every time they look at me that I am not their daughter, really. And that will get easier with time, and I love them so much for being there for me. So back to the GAHT, or the GAP program. I made my appointment for October 5th, 2018, and was very excited to see what was going to happen, because I had no idea like if this was going to be in like a different room of the health center, or if this was going to be multiple people or one person. And so I was intaken just like a normal patient at the health center. I checked in, I sat in the waiting room, I read magazines, my name was called, and then I was intaken still just the same way, with my blood pressure being taken, my weight. They went through my history just like normal. Are you allergic to any medications? Are you still taking these medications? Are you any change in address or phone number? And then I was taken to an exam room. Everything was still very standard. I found it very amusing that I had to sit on the little exam table chair, which had the paper on it, as if I was a sick person. And I was very much there not as a sick person. And two doctors walked in, both female presenting and female identifying, I believe. So they were both women. And one doctor was one from the health center, and another doctor was from a regional medical center, who was training the one at our health center to provide care for trans people. And they said hello, and we introduced ourselves, and I didn't know what they were going to ask about me. So I was trying my best not to be scared or defensive, and I knew that at any point if I was uncomfortable, I was completely able to leave. And they were wonderful. They were just the correctness and tact with which they were able to phrase things that normally would be very cisgendered or heteronormative. Their understanding of the proper vocabulary and terms in order not to discriminate against anyone who could be gender nonconforming or transgender or genderqueer. And something that my health center recently started doing was underneath the name tags of their doctors and employees is a little ribbon pinned under there with their pronouns on them: she, her, hers, he, her, him, they, their, them, etc. And they both had them on, and beyond that, one of them had a little sticker that said ally in training on their name tag, which is always great to see, because you can kind of relax when you see that, that they're obviously not wearing that without knowing what it means, and they're telling you that they're there for you. It's great to see that everywhere. Even, I think it's kind of funny, like in training, like when does your training end? And so they asked me a lot about me, about my experience with gender identity, about my life, about when my dysphoria, about my parents, about my relationships that were romantic and otherwise, and they asked about my pronouns, first and foremost, for sure. They asked about any preferred name. I've been Jax since I was 5, so it really is no big deal for me to be called Jax or have other people call me Jax. Um, and um, they we went over a lot about my history of depression, my recent alleviation of depression, how it's been gone since last August, my history of medications, my past experience with an eating disorder way back in high school. Sometimes I even forget I had that because it's been so long. My daily routines, they asked, are you a drinker, are you a smoker, how often do you do these certain activities? It was a lot like a survey you just fill out online with like, oh, what's the frequency you do this? Doctor questions, to determine what kind of person you are, what kind of state you're in, and it's very important to always remember, never lie to your doctor. You have no reason to. If you lie to your doctor, things could go very wrong. They asked about if I was sexually active, and they were very good about using terminology that wasn't heteronormative or gender normative. They simply asked to say, like, does your partner have a penis? Does your partner have a vagina? They just use scientific terms. Is there this type of penetration happening or this level of intimacy? And what type of contraceptives used, if any. And I was just happy that they were able to see that just because I presented female, like, I didn't mean like I had a boyfriend who was a gender, like, raised, it was a biological man too. Then they handed me some papers that were called informed consent, and those were mine to keep until next visit. And they went over cursory, like, what it was and how it was mine to look over it. If I had any questions, to mark anything down, because you must completely understand what's going on. You must be informed to consent, of course. The doctor went over with me the definition line by line from the DSM-5 of dysphoria and what exactly that is, and also that it must be going on for 6 months or longer. For me, it's been about 7 years, so I certainly qualify for having dysphoria, gender dysphoria, and they were also kind of asking questions to establish if I was what some people call transgender, mostly to determine that I, like, fully understood what this type of treatment I was seeking was meant to treat, who it was meant for, to make sure this desire to transition was not coming from a past trauma, was not coming from misinformation, was not coming from perhaps a multiple personality, that it was certainly because I was transgender. And about that time, like, about an hour had gone by. The other doctor who was with my health center was very attentive. She was learning lots of things from this outside doctor who was coming to train, asking questions. So that it was, I don't know, I guess maybe normally there's just one person there with you, but it was cool having two, because it was great to see her, like, literally actively learning, like, about what the trans experience is like, hearing from me, like, what it's like to live with dysphoria, and that was really great to see. And she is the doctor that has been prescribing me my hormones. The next step was to have a second visit, because there must be at least 2 visits before I can be considered, like, minimally informed and able to legally consent myself to this treatment. And so the next appointment was on October 18th. It was just 2 weeks from the day We had met for the first time, and I brought the informed consent papers with me. I had, of course, read over them, and what was in them was like the risks of testosterone, the effects it has on the body, the effects that are permanent if you were able to stop it, risks if you were to become pregnant, risks if you were a smoker, correlations between possible cancers that it could cause, between problems with the liver, the symptoms and side effects that could occur, which to me are more the desired effects, because, you know, something testosterone causes would be like a deep voice, and that would be not a side effect for me, but what we're kind of doing it for is the side effects. And so I was intaken the same way at the health center. I was, you know, waiting room, weighed, blood pressure, go to an exam room, wait. And the same two doctors came in, and they were sure to go over the definition again, line by line, of dysphoria, to ask me if I felt in any way hesitant or pressured, perhaps, to go into this treatment, which is wonderful of them to ask, because you got to be sure to start this. This is at least what I consider a lifelong commitment. And we went over the informed consent this time, line by line by line, just to fully make sure I understand exactly what I'm getting into. And I could not stop smiling as they were reading things off, because they are just absolutely what I've been looking for years and years. Then I signed the informed consent papers, and I signed one of my health center's papers, which consented to, like, HIPAA, and how they cannot treat me if I no longer become a student, because it is connected to my college. So as soon as I graduate, I'm going to have to make different plans, or in fact, before I graduate, in fact, now I should probably start looking for continual treatment somewhere else. And at the end of that visit, they said they could take my blood, because blood work had to be done to determine a baseline of my cholesterol levels and hormonal levels of estrogen and testosterone. And if they all came back normal, the next step would be for the doctor with the health center who would be treating me to send in a prescription for the testosterone to a pharmacy. And then from there, it was up to me to determine if the price of the prescription was something I could afford, or if we could try a different pharmacy, or if we could try a different dosage, like compounding it. And that was something I was very afraid of, because, like I've said before, like the trans experience is different for every single person. And that includes the cost of things, it includes your insurance, so I was also very curious about this, because money's a big deal. I'm a college student. I tried to ask, like, is there, like, a range you could give me? And because online I had searched, and the range was anywhere from $40 to $400 for all the different types of testosterone treatments, from injectables to creams to patches to gels, to pills you take orally. And the fact that she could not narrow down something in the hundreds of dollars to something smaller than that, more sure, was disconcerting. It was scary for sure. Like, if this was something I had to pay out of pocket, like a couple $100s every few months, that's a really big deal. And so the next day, my blood work was covered by my insurance. It was coded as normal blood work. The prescription was coded as an endocrine disorder. This I really liked, is that it was treated as if I was a man with very low testosterone, and that is why I needed this prescription for testosterone, which essentially makes sense. I do consider myself a man who's just lacking a lot of testosterone, and that is why I look this way. Um, and I had called my insurance before this appointment even to ask if they covered any type of hormone therapy or transitional gender care, and they said no, which is not uncommon and kind of what I was expecting, because it's just not something that's normally covered. And then again, my insurance also doesn't cover eyeglasses and orthotics, which could also be considered like essential things to those who have that need. And so when my blood work went through and the prescription went to the pharmacy, I called the pharmacy, and the prescription was under something called prior authorization. And what prior authorization is when an insurance company, I believe, contacts the doctor to further determine why this specific prescription is necessary, to then see if they could cover it or not. Usually, I would say not, because I mean, if I was an insurance company, I wouldn't want to be covering things I didn't explicitly have to. That's how American healthcare works. And I also learned you could pick up your prescription, you can pay out of pocket regardless if it gets covered or not. And also the length of time prior authorization takes is a week to a month. So I was like really like great, like what, how great, like, you know, I felt like so close, thinking of what I wrote myself in that letter, like, come on, Jax, this time fight for it. Do it. Wait it out if you have to, figure it out, send it somewhere, get it from another country, do it. And I called the pharmacy to see what the price would be if I paid out of pocket, and my jaw hit the ground when she said $28. That was it. It was just $28. Beyond that, I looked up, I didn't know these existed, prescription coupons for medicine. So GoodRx.com I looked up and I searched, and I was actually at the prescription counter and no one else was there, thank goodness. I wouldn't have done this if it was busy. And I was able to search up the exact dosage and size and type of this testosterone and search in GoodRx to find a coupon for $14 more off. And they had said they tried to run it through a coupon before, nothing took, and I said, I'm sorry, like, could you wait, could you please check this one? And they did, and it went through, and so for $15, I got the hormones that I've been wanting for years. For the price of an entree at Arby's, I have what I need to live my best life. And I was so excited. I had to like sit down in the car and like calm down before I drove home, because it just felt like my birthday and Christmas and New Year's were all happening on the same day. It's so wonderful. And I was so thrilled and so happy to just have them in my hands. And the next step was to simply make an appointment with the health center to get injection training. I wouldn't even need to see a doctor. It would just be a nurse. It was the same nurse, I believe, that I went to see that took my blood, and get training to inject it, to watch her show me how it's done, inject it into my thigh, intramuscular needle, and the next time it would be her watching me inject myself, going through that process, and then it would be up to me to keep up the injections, keep up the prescription, and keep up with myself. So that's how we're at day 0. Tomorrow is my first injection at 10 a.m. On October 25th, and I can't wait.